We're now joined by Tara Colton, Executive Vice President of Economic Security at the New Jersey Economic Development Authority. You'll see the EDA's website up. Tara, good to see you again.
Oh, it's my pleasure to be here. Thanks, Steve.
You got, hey, listen, we're in the summer of 2022. We'll be seeing a little bit after as well. Where are we as it relates to the childcare crisis of accessibility, affordability? Our reimagined childcare website will be up right now. A, and B, what is its connection to the economy in New Jersey and obviously beyond?
I think we're at a really pivotal moment. We're obviously now a couple years into the biggest amplification of why childcare matters to the economy, probably in our lifetime. I think the recognition from both employers and workers and working families that childcare is not just an important educational and social development tool. It's also critical to economic stability. It's essentially part of our economic infrastructure. And now that there is growing awareness and consensus around that, you have to compare it against, as you said, the affordability, accessibility, and quality of childcare providers throughout the state. I say that both as someone who's leading the childcare work here at the EDA and as a working mom myself. Something that's really crucial is ensuring that all New Jersey kids have access to a facility, whether it's a center or home-based provider, that their parents feel is of the quality and the learning environment that their children deserve. And so Governor Murphy has been very, very focused on this since the beginning of his administration, but then certainly over the last couple of years in terms of dedicating very significant resources, both state and federal, into strengthening the childcare system, because we recognize it's important both as an employer itself, it's a significant employer in our state, but also how critical it is to our state's economy on a broader level.
What is the specific role of the Economic Development Authority as it relates to helping to ameliorate the challenges of the child care system? What specifically is the EDA supposed to be doing? Please share.
Sure. So we're really thrilled to be playing a leadership role in strengthening New Jersey's childcare sector. It's a table that EDA has not historically been at, so we're very proud to be right up there with our sister agencies and with the governor. The focus for us has been twofold. So the first has been around dedicating resources to strengthen and improve the facilities that child care providers operate in. We recognize that many child care providers throughout the state have facilities that mostly not for their fault or any negligence, but really just tight profit margins and limited resources. A lot of these facilities have been either in disrepair or in dire need of improvements for years, sometimes decades. It's windows that won't open, playgrounds that you can't get to easily, a roof that keeps getting patched instead of just replaced. And so last year—
Sorry for interrupting, Tara. Is the EDA providing, because the program itself is a pilot program. Are they grants, loans to these child care centers? I just want to be more specific.
Yeah, sure. So we are launching a program to provide grants that require no repayment, between $50,000 and $200,000 each to child care providers for them to make these kinds of facility improvements.
Who's eligible? What are the criteria? The income eligibility? Talk to us about that.
Sure. So, so the pool of funding that we have to support these grants total is about $55 million. We have announced the first round of funding, which is going to be at least $10 million in grants. To be eligible for that, a provider needs to be a child care center that serves 6 or more children. And they need to have, within the last year, enrolled at least one child who is enrolled in the federal child care subsidy program. And they need to demonstrate portfolio of projects that they feel could be supported with funding for facility improvements. And there are
sorry, Tara, will that mean they're disproportionately in urban communities, Black and brown communities?
So like many of the other programs that EDA has launched, both around small businesses and childcare, we are setting aside 40% of the funds for childcare providers that are located in opportunity zone eligible census tracts.
One second, there's a lot of inside jargon here, not you.
Sure, sorry.
Opportunity zones are zones established by the federal government, legislation sponsored by Senator Cory Booker and one of his Republican colleagues, I think it's Senator Scott in this regard, that established these zones that the federal government would say, that is a community we need to make more of an investment in to increase economic activity, job activity, and they are in urban communities.
Absolutely, yes. So we expect that 40% of the funds will be earmarked for providers, set aside for providers within those communities. And we also know that because we are requiring providers to currently or recently serve at least one child who receives the federal subsidy, that means that we're going to be able to target more providers who are serving children who are lower income and who are in facilities that have just not had the investment that's been sorely needed.
And I believe that in post-production, our reimagined child care information will be up there so people can access the website and find out more. And Tara has joined us in the past to talk about this issue as well. And let me also disclose that the Economic Development Authority is in fact an underwriter of the Caucus Educational Corporation's programming, mostly on economic affairs. Tara, thank you so much for joining us. We appreciate it.
My pleasure. Thank you so much, Steve.
You got to stay with us. We'll be right back.
New Jersey's early educators and childcare providers are more than twice as likely to live below the poverty line versus the general workforce. If we want our children to be successful, we need to increase the investment in the people who care for them. It is time to build back better by reimagining the way we support these essential providers. Learn more about the Reimagine Childcare campaign by visiting the website at reimaginechildcare.org.
Also brought to you by the Turrell Fund, supporting Reimagine Childcare. Community Food Bank of New Jersey. RWJ Barnabas Health. Choose New Jersey. Horizon Blue Cross Blue Shield of New Jersey. Here when you need us most, now and always. The Healthcare Foundation of New Jersey. New Jersey Sharing Network. And by Summit Health, a provider of primary, specialty, and urgent care.